Hi, I'm Dr. Bernard Teo from One Health. If you're watching this, you probably have a painful ingrown toenail. In this video, I'll explain how a procedure works, what the risks are, and what you can expect during recovery. At One Health, ingrown toenail surgery is always a two-step process. At your first appointment, we'll carefully assess your toe, check for infection, review your medical history and medications, and discuss all your options, including conservative treatment, referral, or surgery if that's appropriate. We'll also go through the consent form on this page with you, explain the procedure, benefits, risks, and alternatives in plain language, and answer your questions before you decide. If you choose surgery, we book a second appointment for the actual procedure. We start by cleaning the toe and giving a local anaesthetic injection so the area is numb. You may feel pressure, but you should not feel sharp pain. We then remove the ingrown section of the nail, and in many cases, we apply a chemical called sodium hydroxide to the nail root on that side to reduce the chance of that edge growing back. The whole procedure usually takes around 20 to 30 minutes, and you can go home on the same day, ideally in an open-toed shoe or sandal. As with any surgery, there are risks and limitations. These include pain, swelling or bleeding, infection, delayed wound healing, permanent changes in the nail's appearance, ongoing discomfort, and in rare cases, a reaction to the local anesthetic or the sodium hydroxide. It is important to understand that there are still a risk of the ingrown toenail coming back, even when the procedure is done perfectly and the chemical is used. So we cannot guarantee the nail will never become ingrown again or that the cosmetic result will be perfect. After the procedure, we apply a dressing to your toe. You'll need to keep the dressing dry for the first 48 hours, elevate your foot and rest as much as possible for 24 to 48 hours, and avoid strenuous activity, sports, or tight shoes for about 1 to 2 weeks. Some discomfort for a few days is normal and is usually managed with simple pain relief. Complete healing commonly takes 2 to 4 weeks, depending on your general health and how you heal. We'll schedule follow-up, and it's important to contact us promptly if you notice increasing pain, redness, swelling, discharge, or fever, as these may be signs of infection. Our goal at One Health is that you feel fully informed with realistic expectations and no surprises. Before your procedure, please read the consent form on this page and note down any questions. At your appointment, we'll talk everything through so you can make a confident, informed decision about your ingrown toenail treatment.